Good afternoon, everybody. We will go ahead and call the CEO Performance Evaluation Committee to order. It is currently 12:03 on January the 21st. I appreciate everybody's attendance and attention and time today. To start out, we would like to give anyone here an opportunity to disclose a conflict of interest. Is there anybody that we have that needs to disclose such? If not, we'll move to the next item. And on the conflict of interest, it just is an update. I have actually talked to Dr. Webb, and as a board, he will be having an item for our signature going forward. I know this is an important piece that I've championed for the last year and a half that I've been a board member, and he's committed to making sure that we have that piece available to have board members. I'd ask him for board members, executive leadership team, and procurement going forward. So this, I know that they're working on that. So I'm excited to, at that point, we should probably be able to take this off so we don't have to talk about it every single time. The next item is the mission statement. David, would you be kind enough to read the mission statement?
Yes. The NGH mission statement is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you very much. Next item on the agenda is the minutes for approval for January 6th meeting. So any comments or amendments that we need to make to the minutes? If not, I'll call for a motion.
I move the approval of the minutes.
Is there a second? Any question? All in favor?
Aye.
Aye.
Motion passes. Oh, sorry, public comment. Let me also retract to agenda item number 4. Are there any public comments?
No, ma'am.
Stated? Okay, great. Thank you very much. Sorry, I just moved past that, so I didn't see that anybody signed up. I would like to, before we start into our CEO performance goals, we do have some attendees here with us, and just so everybody's clear on who's actually in the meeting, I'd like to ask each of those people to, if you're not part of the committee themselves, I feel like it would be appropriate kind of going forward to make mention of who we have as people have the opportunity to speak. That way people are not confused by who's in the room. So that being said, we have Diana, who is our chief of HR. Excuse me if I don't get your exact title right. We also have Bruce, who is our CFO. We have Derek with Metro Legal, and then we have our board chair, another board member here with us today. So we have Dr. Martin and Dr. Miller. So I appreciate all your time, and thanks for leaning in and helping us. On the side note, Bruce just wanted to state, as me personally working with you, in this committee, and I understand you will not be at our next board meeting. Your retirement date is effective this Friday. So I just wanted to let you know personally, with not just this committee, but being chair of the finance committee, that I have enjoyed working with you personally. I have found you a very forthright and welcoming person to me and the others on this committee, and every time I've asked you for something, you have a very quick turnaround, and I appreciate that. So I wish you the best personally. I'm sure our entire board and committee does, and would like to thank you for your service here, and I hope you really enjoy your retirement. I know that I still have your cell phone number. And you have proactively said that you'll take a call from us and not screen us. So I just want to make that to be on the record as well. But I just want to take a minute and thank you personally. So thank you very much, Bruce. Appreciate your service. Okay. We will move on today for the CEO performance and goals. So now that we've had an opportunity on a couple different occasions to obtain data, request and obtain data, have comment by different members of the executive leadership team, and follow up, I think it's prudent for us to go ahead and look at scoring Dr. Webb's evaluation for the period ending June 2024. So that's the first goal today. The second goal would be to look at and review the 2025 evaluation criteria. And then if there's anything that needs to be tweaked on that, we can add that. And so we had a final copy for us to, I'm guessing, do we need to get that approved in this committee? Does it need to be, do we need to have a board approval or no? Derek, are you? I don't know if that requires approval for, if we amend the, sure. I'm sorry about that. The question is, if we amend the evaluation that we're looking at from fiscal year 2024 for fiscal year 2025, do we need to approve that at the committee level?
You would need to approve it as a
Recommendation to the board.
recommendation coming from this body to the full board.
Okay, that's what I thought. So I think that's going to be really important to get in because, again, everything we're doing is going to be probably, a couple week lag. So, all right. So with that, we had talked, I guess, 2 times ago about evaluating in a 1 through 5 method, with 1 being I guess not applicable, or 2 not effective, 3 developing, 4 effective, and 5 as highly effective in these 5 categories: growth, financial, quality, customer service, board relations, and communication. So I had proposed a scoring methodology by which we would individually provide scores in each of these categories, and then those scores would be totaled, our results compiled and averaged, and then that dictating the actual bonus structure depending on the total number of points as an average result. So I think we had agreed that that was a good way to get board consensus rather than trying to, look at more of a pass-fail in each category. So that being said, I'll push pause and see if there's any other ideas or comments from our committee.
I support that, Madam Chair, and I'm prepared to provide my written scores for compiling today. And if that's what we're going to do in this meeting, if there's any discussion that we want to have about it, I have thoughts on globally the evaluation that we're doing for the fiscal year ending 2024 and on the individual categories. But I'm ready to proceed today to do that and move that process forward so that we can wrap that up and then start catching up on things that the board and the committee needs to catch up on.
Great. Okay. I'm just going to write down a tally sheet here. Okay. All right. So we'll start out with the first category, which is growth. Since this is a fairly new way of doing things, would we like to just go through, announce our scores, and then make any comments? Does that seem satisfactory to our committee members?
That's fine with me.
Okay. I will go ahead and start with my personal score, and then we can just kind of follow around if that's okay, and then Craig and then David. Excuse me. In the category of growth, I scored us a 3. Scored Dr. Webb a 3. Specific to this category, I felt that my personal thoughts are there should have been, it looks like a little bit more community engagement. I would like to see a more diverse cross-section of that. I also felt that in terms of the metrics specifically regarding, what I guess our goals with regard to the marketing, whether it be moving the discussions with our potential new hospital forward. I would have liked to see more engagement with the mayor's office or lobbying efforts, more specific marketing pieces and knowledge around that. So I do feel like we had some good patient volume with regard to growth, both at Midtown Bordeaux, obviously the behavioral and women's health areas, and primary care, it looks like was up for the first 3 months. So that is why I scored a 3.
For the category of growth, I've scored a 4 for Dr. Webb, which falls into the effective category. The rationale behind that, well, let me say, this rationale applies to all of these categories, which I viewed my scoring, given that we were talking about a period that should have been evaluated at the end of fiscal year 2024. And being recent to the board, I assume that it's through no fault of Dr. Webb's that the board didn't do what it ought to have done. And there are lots of reasons, I think, why that may have happened. But the reality is that we're evaluating him later in time from when the board should have. And so as a general matter, I viewed my scoring as a check on his self-evaluation. So what I mean to say is that I think, in fairness, Dr. Webb's self-evaluation from my scoring played a prominent role in the scores that I gave out of deference to his own self-assessment and the timing of what we're doing. So the reason I score a 4 is because based on the information that he's provided in the self-assessment, using the measurement criteria, the patient numbers seem to be on target or exceeding target, and so he has met that. This is my own commentary. Having such a strong part of this growth area be social media, I don't know that going forward I would think social media metrics should play such a prominent role in CEO compensation, but they are part of the criteria that are presented here. I would say that those numbers, the thing that prevented me from giving a 5 was that social media relative to other benchmarks that I looked at was relatively weak. So if you look at the number of followers on Instagram of the hospital versus the parks or the library, it's significantly less. I checked the followers on social media for maybe a comparable institution, which is the public hospital in Jackson, Tennessee, which has several thousand more Instagram followers. So again, that metric to me is not as important as maybe it was to the board that established that as a metric. But when I look at that metric, I'm not sure I can say that the social media effort has been highly effective relative to other things. And that's my rationale for scoring it a 4.
Thank you.
So I'm going to go ahead and score a 4 as well, and rather than go into my notes, which really complement and support and are basically in repetition to both the comments of the chair and of my colleague, so I'll just leave it at that as a 4.
Thank you. The next area is financial. Same format. I had scored Dr. Webb a 3 in this category. Specific to the audit process, which is a little bit deeper than the clean and unmodified terminology that is here. But since we had some findings that have been a consistent drag on the management letter criteria, I feel like that needs to be addressed. The other piece is accounts payable. Accounts payable, while it did decline, we are pretty significantly over what my understanding of these types of institutions should have in accounts payable, which is closer to a 45 to 60 day range. And then the other piece was with the budget. While I guess we did have a good year, which my understanding of conversations is normally about a and Bruce, correct me if I'm wrong here, but normally about a kind of negative $4 million annually, a normal annual number of negative $4 million, we were actually close to being a little under $1 million to the positive. And that's due to ultimately some unique funding that was created this year to multiple hospitals for about the tune of $3 to $4 million, and then a $3 million adjustment that was made at the audit. So if you take both of those numbers, we're still positive, which is ahead of the negative $4 million. So for those reasons, I scored a 3.
I scored a 4 for the financial category, and I think my rationale largely tracks yours, Christy, that largely positive financial results if you use the measurement criteria that are part of this, meaning the audit, the cost of providing uncompensated care versus the Metro subsidy, and timely collection of AR and accounts payable to vendors. The reason that I think the deficiency that I found and the reason I scored it a 4 and not a highly effective 5 is failing to meet the budget for net patient revenue, which I think is a way of saying what you were saying, which is there was some one-time revenue that came in that helped improve the financial picture, but that net patient revenue is the kind of year-to-year metric that's going to show sustained growth. And so the failure to meet budget for net patient revenue was a significant enough to me disappointment in the numbers that merited a 4.
I too gave Dr. Webb a 4 in this category. Again, I am swayed somewhat by the comments of the chair, who has much more expertise in the financial area than I do. But at the same time, I look at the numbers from a distance, and I'm not quite as dismayed, so I leave it as a 4.
Thank you. Moving on to quality. Okay. All right, in this category, I also scored a 3. With regard to quality, I feel like, and I do understand there is a old data lag with regard to the specific timeframes for the leapfrog grade. So it looks to me as these are potentially close to a year behind in terms of leapfrog. Is that correct, Diane? Okay. So again, instead of guessing what it might be, the only data I have to look at is, and eventually it all kind of catches up, I guess, year over year, just knowing it's behind. The current safety grades we scored were a C. I think that my understanding of multiple conversations is that this is significantly improved, and we're tracking towards an A, but knowing that what we have to work with today is a C, that is one of the metrics I use to consider this score. When we look at the quality dashboard, the other pieces that I think ring out is the benchmark, which my understanding is when we look at, and these are given as of August 2023 and also given at each meeting, the concerns in the specific categories that came out for me was hand hygiene, sepsis, cesarean birth, responsiveness of staff, cleanliness, and the quietness of the hospital. So we had issues where those were not meeting our own benchmarks. And so for those purposes, I gave us a 3.
For this category, my score was a 2. And I thought that was appropriate when I looked at the timing. So I looked at the leapfrog grades, and the period that we're looking at on that chart is fall of 23 and spring of 24. That's the period under review. The prior year, the prior spring at least, was a hospital safety grade of C, and there was no improvement from that grade during the period that we are reviewing. And in fact, some of the individual categories were worse during that period. I know that having joined the board a couple of months ago that our leapfrog grade dramatically improved last year, which is fantastic. I think that would be reflected in Dr. Webb's performance review for the fiscal year ending 2025, and we look forward to celebrating that. But in all candor and honesty, maintaining a safety grade of C and not offering improvement from the previous year is really not effective in a core function of the hospital. And so because, again, the metric that measurement criteria that we're using is the leapfrog grade, that grade for this period remains unacceptably low. And so for that reason, I have a 2.
So I had some mixed feelings on this one because I tended to look at the quality dashboard as my guidance. And I too was concerned about, in particular, goal number 4 on the quality dashboard, which was about patients, and we are about patients. And those numbers are less than we had hoped that we would achieve. And so for that, I give Dr. Webb a 3.
Okay. The next is customer service. For this category, this category was a little less, I guess, questioning for me in my mind. I do feel like we had some great HCAHPS scores, which is the Hospital Consumer Assessment, and Healthcare Providers and Systems scoring. And so I'm under the understanding that 77% is the score that we created. The AHA Regional 4 Hospitals benchmark, which is basically the hospitals in our region, their benchmark was 71.33. I'm assuming that is in line with the same time frame. And so I was comfortable with us. We exceeded our goal by the 77%, which was 77.63, and then even trended up. The employment engagement survey, which was another piece I saw, was positive here at 65% response rate and a 3.92 out of 5 in terms of the employment engagement survey. And then there were goals set. What concerns me the most, to be honest, in this category is the physician's engagement survey. It was stated that it was deferred due to timing with Cerner, but when asked specifically about last year's survey, it came to my attention that it wasn't done then, and it hasn't been done since 2021 and possibly 2022. So that is something we definitely need to make sure happens. I've also asked specifically in other board meetings, so I want to say again for the record that I've asked about a physician's and employee exit interview to be done, and I'd like to make sure that we could include that criteria going forward. So for that reason, I would score us a 4 in this category.
Your assessment is exactly in line with mine, which is my concern was the lack of a physician engagement survey. And now with the information that survey hasn't taken place, not just this year, but for several years, that is an even higher concern for me. The self-evaluation of Dr. Webb saying that the Cerner implementation prohibited the survey really didn't make sense to me. Why you can't have a survey and implement electronic records. I mean, if there's some commentary someone wants to offer, I'd be happy to hear it from any of the
I think we have to make sure we're looking at the right year.
I'm in the self-evaluation. Dr. Webb said in this category that the physician engagement survey was not completed due to the Cerner implementation, is what I
But
read.
Cerner implementation was
This year, not last year. So this
25.
this is an error on the report.
Right.
Well, I
correct.
assume maybe the implementation was completed this year, but was in process last year.
No.
Is that not right?
Identify yourself too, please. Thank you.
Diana Wolford. Actually, the Cerner implementation takes an entire year. So we started it in probably fall 2023 because we were going to launch in June and then we were delayed, just so you know. So it's a very large implementation for the EHR. So just just want to make sure that you know that. And so, in the physician engagement survey and the employee engagement survey, we attempt to do them in tandem, but they come from two different departments. So,
Okay.
Just want to be clear about that.
Thank you.
So it does make sense to me that the Cerner implementation was ongoing, as you said, during this period. And so I do have the right period for Dr. Webb's self-assessment. And the whole gist of that is that one of the main criteria for measuring is the physician engagement, and we don't have it. And so that's a problem. So I have scored it a 4, and I'm willing to stick with that score on what I said earlier, which is I think, I defer to Dr. Webb in a lot of this, given the timing of what we're doing. I actually think 4 is probably a very generous score given all the circumstances, but I'll stick by a 4 for that category.
David, thank you for your clarification on that, and forgive me for not having that right. And thank you for clearing that up. I, too, give a 4 with some hesitation. I almost want to have a fractionalization here because, yes, these are the numbers, but we're looking at something that was coming up on almost a year ago, and I'm having some level of difficulty going back in time. So I'm going to do the benefit of the doubt and give a 4.
Okay, thank you. The last category is board relations and communications. I think this was a hard category for me to score, considering there wasn't any specific metrics. It was just, it feels more personal and maybe ambiguous to score as a group. So I can only go by my own criteria with regard to measurement here. Develops and maintains effective working relationships, keeps board fully informed of important developments, and provides clear and timely information. In this category, I feel like I would probably score a I'm going to give him the benefit of the doubt as well. I'm going to go with a 3. I'd originally scored lower than that, but because I feel like the information that I get in the board is directed at us from a public meeting standpoint, not something that I might have where I have received information either prior to as a direct call or a specific email, or maybe addressing a concern or being collaborative with me as a member of the board. I feel like I get the information in the public with the board. I have in prior boards, as I've stated in the past, received a lot of this information and conversation at a one-on-one level, having at least quarterly meetings with the executive director or CEO. That also has not been happening. So for that reason, that's the score.
Because I joined the board after this time period, I have no personal input on this. So I, again, am basing my scoring on Dr. Webb's self-evaluation, and what I would, and my observation from what he wrote in his self-evaluation is there was a clear focus on Dr. Webb's communications with the chair of the board, whereas the measurement criteria talk about the entire board. And my sense from that and from my brief time on the board so far is that Dr. Webb may have been more effective in communicating with the board chair and less effective communicating to the entire board, building consensus among the board. Again, that's a preliminary observation, and that's an observation that I make based on Dr. Webb's self-assessment. And so for that reason, I give him an effective grade of 4.
This is an important category for me because I think communication is one of the most important things that a CEO can do in any circumstance, in any environment. And I think that since coming on the board, I have seen an increase in the level of communication, and I'll come back to the quality of that communication in a moment. But that communication during that fiscal year was lacking, in my opinion, and has been a constant source of, frankly, some irritation for me. I have consistently felt that the update at the board meetings has been rather thin of substance, to refer essentially to things like announcements about recognition of employees or celebration of certain events, rather than discussing more relevant substantive topics that are important to the board. And to the chair's point, I suspect sometimes there is a limitation or a guard as a result of this being a public meeting. Nonetheless, I think it's important for substantive information to be shared on a timely and regular basis. And during that, which was my first year on the board, full year on the board, I give Dr. Webb a 2.
Thank you.
May I ask a procedural question now that we've been through these? We have a third member of the fourth member of the committee that's not present. Is there a plan to, I mean, how do we account for that is the question.
I would ask legal their opinion on that, but my understanding is if you are not present physically in Metro board meetings, there is no alternative way for either your comments and or scoring in this case to be counted or recognized.
Okay, so the committee, all right, and for that reason, then we will and have to proceed only with the members who are present and participating. Is that right?
That's correct.
Okay, thank you.
So the categories, just for the record of growth, I had a total of 11 points, financials 11 points, quality 8 points, customer service 12, and board relationships 9. Double check my math here.
I think I had a 10.
Did you have a 10 here?
4, 2, and 4. Board relations.
I have 3, 4, and 2.
I'm sorry.
Yeah.
I am.
Okay. Okay. So a total of 51 total points divided by, okay, divided by 5 categories gives us an average point total of 10.2. I'm sorry, hold on, sorry. I apologize. I'm looking at the wrong thing. Divided by 3, which is 17 points divided by 3 people, sorry. Brain is not working yet. 17 total points out of 25. That puts him in the category of a B out of an ABC category as defined by our last meeting, and I'll make sure, Janet, you receive that scoring. So category B was a total of 12 to 18 points, and he received a 17, which would mean that that bonus would correspond to a 3 to 4% bonus. And I think at this point, the 3 of us could consider specifics between 3 and 4%.
My suggestion, given the tardiness of doing this evaluation and my overall sense that, in fairness to Dr. Webb, any kind of marginal call ought to be decided in his favor, that if the scoring results between 3 and 4%, then my recommendation is that we would recommend to the board a 4% discretionary bonus for this time period.
I agree with my colleague.
As do I. And for anyone out there who is listening and this is your first time, we want to make sure that you understand that our committee is very committed to getting this back on track. None of us were part of the prior committees that were specific to these delays. All members find it unacceptable and are doing our very best and committed to multiple times a month to make these meetings happen, to review all the specific information that has been given to us and has been requested, and we'll do our very best to get back on time and back on track.
And Christy, to the extent I haven't said it yet, I really appreciate that. And I really appreciate your leadership in getting us back on track, because I understand that this is through no fault of anyone who's sitting at this table, but we are tasked as current board members to fix it. And I know you have worked very hard to set these meetings and get this on track and get this process going. And I very much appreciate your effort on that.
Okay, the next item on the agenda is the period ending 2025 for CEO performance evaluation information. Excuse me, hold on just a second. I'm sorry, I need a motion
I
to,
don't think you need a motion in a second.
sorry.
It's okay.
I am thinking about staying on time as I try to do.
I understand.
I
Okay.
move we accept the recommendation of this board, of this committee.
Which is to provide a 4% bonus, discretionary bonus to Dr. Webb.
Thank you.
Yes, and I would second that.
Uh,
All in favor? Okay,
Aye.
aye. Motion carries, and we will make sure that this gets presented to the full board with comments at our next board meeting.
I just recommend that the chair refrain from first or seconds on a motion.
Got it. Sorry, Derek.
If I may, so I would like to second Mr. Lesser's motion.
Understood. Please make an amendment to the minutes, Janet. Thank you so much. Derek, thank you for the legal advice and guidance, as I'm not an attorney. I appreciate that.
You should now call discussion and a vote. to
Yes.
complete it.
Is there any discussion with regard to the motion made by Mr. Lesser? No. If not, hearing none, then I will call for a vote. All in favor of the 4% discretionary bonus recommendation to the full board?
Aye.
Aye.
Aye. Motion carries. Thank you. Okay, so now we will move to the June 2025 CEO performance evaluation. And the goal of this piece of business is to review the criteria, make any changes, and or request any information, further information by the leadership team to help us refine this for the next evaluation. So. Janet has provided a template for us to be able to take notes, and thank you, Janet, for creating these goals. So you will see in the left-hand column the goals from this last evaluation period, but also an area by which we could discuss those and then make amendments, because I know some of us have already made some notes and we feel like we should make adjustments. So we'll start out with the growth category and go from there. So specific to the social media engagement, I think Mr. Escoval, you had made mention to potentially either amending that or removing that going forward.
Well, I guess I'm not sure when it says review the metrics, how I use that as a basis to evaluate performance over the course of the year. First question, is it, are there more followers? Is there more engagement? I'm not a social media person, but just sort of, there's got to be some maybe more specific metric. The bigger point is that I don't mind having social media be part of this. I will say that to me it means, are we telling the story? And social media is a way of doing that. So the overall category is growth. If we're going to specifically call to social media, I would want to know, like, is that message getting out? And I would defer to others who know how to track on social media whether we are effectively doing that or not. So, yeah, I'm guess rather than metrics, I might use the word engagement without the metrics. Like, what level of engagement are we having on social media?
Okay, I agree. I'd made a note on my documents prior to this meeting specific to changing language with regard to review, because I don't like that term either. I don't, just because I review something, to me as I read it, that doesn't define, or is someone having success or is someone lagging in this category. So I would agree with that language change. I would like to see, instead of review number of community event participation or speaking engagements, I would like to see that further defined into the different types of engagement and making sure that we're reaching our entire community of our city. And so whether that's meetings with our heat map, which we have, so we have a lot of clients that come from, customers come from, let's say, Antioch. Are we doing community engagement and outreach in those areas? And working with also our state lobbyists and making sure that we have engagement with the mayor's office. So I would like to see some criteria or language around those specific topics as well.
Madam Chair, it strikes me that we have some words here that are lacking an overall purpose. What is it we are trying to achieve? What is it we would try to achieve with social media engagement? What is it we're trying to achieve with these community events? What is the ultimate objective? And is that to increase knowledge of the hospital's assets in terms of what it provides the community? Those are the kinds of things I think we ought to be looking at as an overall direction.
This is Diana. Can I use some terminology for you? I think that the words of penetration into community knowledge of who we are, that language penetration means that you actually have acknowledgement. So it's not just about a touch that someone knows who you are, but actually penetration into the community. So all those things that you listed, those words, so that in itself has a defining metric from a word standpoint, right? How are we penetrating to this community, this community, this community? So there's an overall knowledge of who we are in the community.
But it's not just the knowledge, it's the effectiveness of that knowledge. What does that translate to in terms of the overall goals of the hospital?
So therefore, if we are penetrating to those communities, we should see an enlargement of our numbers of folks accessing our facility. So it's about access. So the more we're out in the community engaging.
But don't you think we ought to define that rather than come back to that
Yes.
6 months from now and say, well, what did we mean by that? Let's be purposeful about what we mean.
Let's put a metric on it, like 1 or 2 or 3%. So we have to have a baseline where we're at, and then put a percentage on there of, because part of it is we should be able to see an increase in our activity, whether from a patient volume standpoint. It's not just about the access. It's about, there's just like anything, other business, there's people coming to the city on a regular basis, daily. So how are they knowing who we are and what we provide for the community? So.
I have a note here, I think that Kathy spoke about, which was a measurement criteria, which was about cost per patient. And maybe we work with the hospital to better define that, but I know she had brought that up in one of the meetings, and I had that as a side note.
You mean cost per patient, which is marketing generally? Like, is that what what cost are we measuring there per patient?
I don't know, I'd have to follow up with her and see this is I had it in the notes under Kathy that she said that might be a good measurement, I think. So we can reach out to her on that.
But again, let's keep the context in mind in that we are more than halfway through the year.
You're right.
And so a lot of what I think we're talking about is for the next fiscal year to make sure that we have nailed that down so that the CEO knows exactly beginning on July 1st what those goals and accountabilities are. I mean, I'd hate to impose that 6 months after the year
Understood.
started.
I made a note on that just for 2026. So is it our intention, or your intention to generally leave these categories as is then, Mr. Lesser?
I do, with one exception. I am hesitant to always allow, in looking at goals, meet, because meet is average, and we should be exceeding goals each and every time, or at least that is what the Holy Grail ought to be. Meeting a goal would mean getting a 3.
So as an example, in measurement criteria, if we look underneath that, says review social media engagement. That would be increase social media engagement from fiscal year 2024.
Correct.
Is that correct?
Yes.
And are we looking at defined by 5%? Do we want to even get that far as a committee?
I don't think we do for this fiscal year that we're looking at, because I think that would be inappropriate because 6 months have already gone by. But I think that's an important element to include for the fiscal year 2026.
So we will, Janet, have these revised to show increase as over the fiscal year 2024 numbers for each of these criteria under growth. The employee retention metrics I see here, they were not on the self-evaluation. That's one point I wanted to make. For the 2024, we did go over them. I have a question mark beside this, but I did see that there looked to be about 14.97 or 19.72, less than 15% turnover, and less than 19% turnover in nursing. So I'd like to make sure that we define what those actually are. Obviously, I'm not going to ask Dr. Webb to go back and add those to self-evaluation, but I want to be very specific to making sure that if the question is asked, then that's answered effectively. So in this category, it literally says employee retention, and there's nothing there on the self-evaluation that was received by us from Dr. Webb. So again, let's make sure that those are specific to not just a measurement criteria, but we need to put in writing what those were from the prior year. All right, moving on to financials.
May I ask one more question
Oh,
about
yes, of
growth?
course, I'm sorry.
If there's, I know we're going to take the word review out for a number of patients seen at Bordeaux and Charlotte clinics. Is there a reason to limit patient volume to those two facilities rather than, in the board meetings I've been in so far, there are patient volume targets for the main hospital campus, for the clinics, I would hope the new imaging center. So my suggestion would be that rather than just review what they are, that we say that the patient volume targets throughout the organization meet the patient volume target. And again, a 3 would be that we meet the targets. Mm-hmm. Exceeding the targets would be superior performance that deserves a bonus. So anyway, I'd suggest, unless there's a reason to specify Bordeaux and Charlotte, I'd rather take those out and just generally refer to meeting the patient volume targets.
I agree with that. And I think maybe the reason those were in there is because with regard to the terminology of growth, those were brand new items and clinics during that time frame. So I think that's why the focus was there. But I would agree and want that
So it should be to all facilities.
For all facilities.
I would hope that we'd be growing everything unless there's a reason not to grow. I don't know what the reason not to grow would be.
Well, there's certainly ample opportunity.
Yes.
Right. Okay. Anything else on the growth category? Okay. Next category is financials. So in this category, I would like to make sure that we're amending the prior year fiscal year clean audit to one that would include language around addressing items within the management letter received by our auditor and making sure that we were on track and or completed at least 75 or 80% of those items outstanding. And so I think that would be reasonable, as well as having an on-time audit. Our audit is understood by a conversation with Bruce, our CFO. The goal would be to have that finished by 12/31, so not just finished but approved. So I would like to see both those items added to that category.
Mm-hmm.
I would like to see added to the measurement criteria the what is the overall goal and objective, but I think would be helpful to be a specific criterion, which is performance under the budget. And I mean the budget, that revenue, individual and collective revenue targets are met, and that expenses stay within budgeted expenses. And that seems to me to be the core, actually, of the financial evaluation, which is, did the organization stick within, did it achieve the revenue that it sought to achieve at the beginning of the year, and did it limit its spending to that which it said it was going to limit its spending at the beginning of the year? And so that's surprising to me that's not among the criteria, and I think it ought to be an express criteria.
Agreed. I would also like to state on fiscal management, timely collection of accounts receivable. I would like that to be a target to get down to our 60 days, which is the top end of average, I think, as stated by the CEO to me. So I want to make sure that we are focused on at least being in line.
So you'd make that specific?
Yeah.
Okay.
I mean, unless somebody tells me differently, but.
Well, no, I mean, I think that's part of what we've been dealing with, is we've been non-specific and vague about so many of these categories and what the accountabilities are, that it leaves it open to argument from anybody looking at this. Well, why did you make that determination? And I think the more we define, the better off we're going to be. We're continuing to refine this process, and hopefully for 2026, we'll have it down even better.
The other piece I wanted to just run through the committee, which is this piece of annual cost of providing uncompensated care versus subsidy. I don't know that that's specific to a goal and objective, because that seems to be not a goal and objective, it just seems to be a fact, so I think we should take that out.
I agree with that. I mean, is there ever going to be a situation in which our Metro subsidy is more than the uncompensated care?
Well, I think it's complicated.
Okay.
I think it's complicated because there's a political aspect to this. And it's what our working relationship with the city, with city council, and with the mayor's office is. And possibly being more effective in our efforts and relationship with both entities, maybe we could be doing a lot better and have that compensation further match, or even, well, I don't know that exceeding is the appropriate thing to do, but certainly to match what we do end up having to spend. And that is a complicated cycle that could end up being corrected in the following year. But nonetheless, I think we can and do have the responsibility to do a better job of trying to make sure that that gap is smaller and smaller each year.
Mm-hmm. Yeah. Makes sense. Makes sense. I do think that as a practical matter, maybe what you're saying is that as a judging whether the CEO's performance deserves a bonus and in what size that metric for fiscal year 2025 is going to be the same as it was, and it's going to be right.
Clearly, but I think we're trying to,
Yeah.
again, hone in on where we need to be rather than where we are now.
I
That
think
make
that,
sense?
Yeah, I guess, but, so as I understand this, I think we should take it out. But as I understand what it means is, we want to demonstrate, the CEO demonstrates a significant return on investment. So Metro's subsidy is $60 million. If we can provide $500 million of uncompensated care with a $60 million subsidy, then we're doing something pretty remarkable, and the CEO is, responsible for that, then the CEO ought to be compensated for that. And so maybe that's what this is, but I don't, I don't see how in its current, if I'm just looking at those numbers now without looking on what progress we're making, or how that number is growing, it's not a very useful metric for me to determine the financial. But I defer to you because you have been here longer and maybe understand better what the role of that metric is in assessing what we're doing.
David, I may have been here longer, but maybe not understand it any more than you do, and maybe even less. I just think that is a complicated issue that is not what it would appear to be. And I might ask if our outgoing CFO might have a comment about that. A brief comment.
and I think the specific question is, should it be included? Not that it's not important. I think that might be a specific differentiation here.
It might be important. I would tell you it would probably be extremely difficult to measure success. I mean, what David said, 60 million and you do 500 million of free care or whatever, that's real clear cut. But unless we ever got to the point where every uninsured claim was submitted to the city for reimbursement, you'd be just playing a game. I do think it's pretty close to what we provide in free care, including the sheriff's office, but there have been a couple of years where I'd say we got a little more and a couple of years where we probably got a little less. Just me, cocktail napkin, working out the numbers based on ratio. And I did talk to Christy about that yesterday. I think you've got better things to measure the CEO's performance against than that one. It could be in a qualitative. I don't know that it's a good quantitative measure. Are you providing what the charter says you're supposed to provide at a reasonable cost?
I suspect then maybe my concern goes in another category, and that has to do with our external relations, because that has to do with the amount of money we get from the city. And that's my issue.
Okay.
Not necessarily what our return is, but are we doing the best we can with our consultant and within the efforts of the executive team here to ensure that whatever the distribution of dollars is from the city in this category, that it is absolutely as close to our need as possible. And my understanding is that it has not been.
Are you saying you got that understanding from me?
Yes.
Oh, no, I would disagree. I think that we're very close to the amount of support that we get from Metro in terms of what we provide to uninsured charity patients. We're very close. In a few years, Metro has given us a little more than we've provided. In a few years, they've provided us less than what we have gotten. It's close. It has been remarkably close for 6 or 7 years. The more insured business we can do, then we should be able to squeeze that number down. That's part of the business strategy, obviously.
That's one side of the equation.
It is.
But there's another side of the equation as well, and that's my concern.
Okay.
Nonetheless, I'm
Understand.
probably making a bigger deal out of it than it is.
Well, just to make sure I understand this, Bruce, because you had were generous with your time and helped me with this as I've been, asking lots of questions. But my understanding is 45% of our patients in gross revenue are indigent.
That's about right. Charges.
Charges, okay. And then with regard to uncompensated care that we bill out, we've got a total of about $140 million
Last year.
in uncompensated care that we bill out. 45 cents of every dollar to provide that care for those patients. And as an example, and I just talking about what this, the city is using comparative to us. And I just want to make sure I understand this is you stated that as an example, part of that care is to the sheriff's department, which is not reimbursed back to us. And that is during the 11 months, it was about $13 million of charges. And if you equate that to 45 cents with regard to that reimbursement, that came out to be about a $5.85 million cost to the hospital. So I think that there is so much that myself and probably a lot of us on the board are trying to better understand. And I think, that can tie to the performance. I'd like to also state, though, that with regard to specific areas of financial, it's not just the money coming in. To your point, David, it's the money going out. And so controlling those expenses, looking at things like clinical needs analysis to make sure that we are maximizing what we do have, to make sure that our staffing levels are appropriate, to make sure that what the services that we have with regard to the infrastructure meets the needs of the city and what we both have to keep our doors open and to be appropriately engaged, whether it's at different laboratory requirement levels, but also, and for people who come in at any given time who have an emergency need. But I do think that remains to be something that I would like to kind of put a pin on and make sure that those things are thought about, because again, you gotta add to the top and cut from the bottom. So I think that we need to be thoughtful about that. Any further comment on that category? Thank you. Chair recognizes Dr. Buzz Martin, who's in attendance and chair of the board.
I think this is a really interesting topic and also really complicated because, charges would not be the thing to measure. It would be, what your net revenue might have been had those been paying patients. But, as mentioned, if we could say that a $60 million subsidy resulted in significantly more than that value in indigent care, that is wonderful in supporting the mission of the hospital and the CEO. And I don't think I've ever seen a number like that. If we could get to it, I think the board would like to hear it, and the mayor's office and the public and the council would like to hear it. Anyway, I don't know that it needs to be a part of the CEO evaluation, but it would really be some interesting information to have.
Thank you. And that is where I understood in my conversation with Bruce that, if you take the $140 million, multiply it times the 45 cents, if you will, that takes us to 63. And then how does that compare to what the subsidy from the city is? And that's the basic math that I had asked for to be able to better understand.
That's how finance people think, Dr. Martin.
Well, every time it's kind of made public what the subsidy is, there are people that say, we're pouring more and more, into this. But yes, if we're doing more and more with it, that should be the answer.
I think that's such a critical point because it's the implication on so many other issues that we're trying to achieve. Whether or not we are moving forward with a new hospital, whether or not we're trying to raise money in the community, whether or not we are showing our best foot forward in dealing with this entire community at large. That's an important element because thus far we've not really touted that in any way to show that return on investment. And if we are able to do that, it's not only showing our financial finesse and expertise, but it's showing that we're operating this the way I think most people would expect us to do something that's really good in the community with a wise use of taxpayer money. And that's why I think this is an important component. Because it's not just about the numbers themselves, it's what they mean and are relevant to other issues that we're trying to achieve.
And we would have to be careful because, others would be ready to respond with, well, every hospital in town provides indigent care, but only one gets a city subsidy. So you just have to be careful about how you frame it.
All important points. Thank you, Bruce Buzz, for being part of that conversation. I think the consensus is it's maybe taken out as a metric, but the information is kept in for purposes of conversation and specific to a better understanding. Is that fair?
Yes, I agree with that.
Okay. Any other further comments on finance, the financial aspect? Okay. Seeing none, we'll move to quality. My initial thought here would be to take out maintain accreditation and certification. My understanding of this is it's a very, very basic criteria, meaning if you have a heartbeat, then you're a human. So I don't know that that's helpful. I think that's basic, and so I'd like to see that removed. I had noted that I think the review part, and I think David, myself had mentioned take out review, but maybe increase the leapfrog grade or score that we have. And then also it says measurement criteria is the quality report for the fiscal year, but I'd take some recommendations from the committee as to potentially focus on a certain metrics there, or how we would frame that as a measurement criteria.
So a question is, the quality report, I understand, is this quality dashboard, which is information the board receives at every meeting and is an overall, our quality dashboard is what it's called. I'm comfortable using that as a criterion because it does speak to quality, and if the board has adopted that as the measurement tool, then it's appropriate to measure the CEO with that.
I agree. There's no need to reinvent the wheel.
Okay, perfect. So we'll use the quality report in its entirety and change the language from review to increase our leapfrog grade from fiscal year 2024. We would need to change the goal objective from maintain accreditation certification. Yes, we would need to add something. I'm blanking at what that would be at this exact moment.
Could it be aspirational, which is,
Yeah.
Achieve highest quality and patient care quality standards of, something that's lofty, like let's improve and let's get it the highest that it can be, rather than let's stay accredited.
Madam Chair, on leapfrog, our most recent leapfrog grade was what? Yeah, so it's sort of like improve or maintain, if we can have A every year, we're happy. So how do you improve on?
The greater of increasing or maintaining. The only thing I'm a little worried about with maintain is if let's say A drops to a C,
Yeah.
and then I don't want, it doesn't need to be a C again. I think, we can work on the wording, but
It could be.
it's fair.
Something like improve or maintain excellent leapfrog, or maintain high standard leapfrog score.
Yes.
We're going to get some advice here.
Yeah, constantly
Diana.
achieving the highest score.
So usually when you look at something, what is the lowest acceptable? We want an A, right? But we don't want anything less than a B, right? You know, B is probably standard, so maybe a B or above. And so because of the fluctuation of how leapfrog works and the data and the elements and things that you're improving on, you can always say we want it, if you got an A, maintain the A, but do not go below a B. Does that make sense? So you want a B or above. So somewhere in the language, you don't want to go below the acceptable standard of the community.
I wouldn't agree with that. I go back to David's comment about being aspirational in this statement. And the aspiration is to always be at the highest level.
Okay. And totally get that. But when you were looking for a standard of a baseline language, Dr. Miller wanted language to be able to not have the fluctuation of a standard of if you're maintaining an A.
If there's
is
an
a
appropriate
criteria.
reason for that, each year we'll understand what that is.
All right, that's fine. Just
All right, any further discussion on quality? And we can wordsmith this a little. I know Janet's going to do some modifications, and we'll work to get those in. We'll create a draft, send it back out to committee, and then, we can wordsmith it from there, if that's okay. All right, moving on. If there's no further comments on quality, we will move to the next category, which is customer service. I think adding the metrics around the HCAP scores to continue to push those higher. So at 77% was in 2024. I'm not sure. Diana, do you know who sets that score? So who set 77% in the past?
I think the organization looks at that from previous data, and then we set it based on the data that we're going. So we're always moving, kind of like employee engagement, we're always moving forward with where our standard is. So we look out, we do a projection, and then we say, okay, we want to move the standard up. So that's how that criteria is set.
Okay, and it also said that new goals would be established in our next strategic planning session. When is that?
That happened last week, so
Great.
those goals were set last week.
Would you know what the score was?
No, ma'am.
Okay, we need to follow up and find out what score was set for that strategic planning session. That'll help define that goal.
I think there's a typo here that says physical engagement survey results, and that should be physician engagement survey results, I believe. And to our discussion earlier, I think it will be absolutely essential to have a physician engagement survey results, because if it's going to work like I understand the employee engagement, it builds each year, and so there's a baseline that's established, and then there are targets that are established for the next year based on improving from the previous year. Well, we don't have any data like that for physicians, and we absolutely need to start now, I would think. So anyway, leave it in there, but I'm saying out loud that to me, that is a really critical part of something that has to happen before June of 2025.
I agree with that. And as soon as I obtain that data, I've already requested that as of this morning. So I will send that out once I receive that. So everybody on this committee has that data that was back in 2021.
Madam Chair, when we get that number of what the committee agreed to, the new number, I think it would be helpful to know that. And I think about this in terms of the CEO setting what we used to call a BHAG, but I won't repeat what that stands for, but it's basically a big goal. And it's making sure that it is not just something that we're comfortable with every year, not moving it up to 2 percentage points, but setting something that that we think is maybe even beyond our reach, but that we should aspire to. And I think that's an important element, particularly as it relates to customer service. I mean, frankly, 77% doesn't sound all that wonderful.
And I just received an update that it's not yet complete, so we'll ask leadership to make sure that's a takeaway, so we have that readily available so we can get these goals finished up. I think the other piece here is, with the engagement goals as an example, the employee engagement goals, they set this, and I don't know who set this, but it looks like there are different thresholds. There was a baseline of 3.92 with the employee engagement data and reference Press Ganey, which is an independent company that rates hospitals and organizations. They do employee and provider engagement service and patient satisfaction, as I understand. And our 2025, there's a threshold, a target, and a stretch goal, which it looks like they set. I'm guessing you guys set in the past. Is that correct, Donna?
We use the data from Press-Ganey, who actually helps us with those goals because, again, each year it depends on who responds, and our category, we're in the Northeast region, so we compete against every hospital within this region. So as they get their data in, and that's why the metric changes a little bit. So that baseline, that midline, and then that stretch goal is for us to get to that stretch goal. And so there's usually a 1 and 2 and 3 year goal. So that's our goal, is to maintain our engagement with our employees, making sure they're responding and actually taking the survey. And then when they do respond, that we respond back, and that we our number continues to rise, and from an engagement standpoint. So that's why you see the 3 different metrics. And those, I know it looks like a smaller amount. What's the difference between 3.92 and 4.02? It's significant because there's probably over 1,000 hospitals within this radius of this region, Region 4, that are responding as customers. And so their data is being put into the system, and then they put our data in there, and then they do the analysis and then bring it back to us. Just want to be very clear about that. So that's why there's always a movement goal.
Are those hospitals just a geographic radius? They are not defined for purposes of, I guess, like an index teaching or county hospital comparative to a private hospital?
Yes, they're not as, they're participating hospitals. We have asked for that before, to actually try to do a carve out. It's a little bit more difficult, but we can go back and ask them again to do a complete carve out. The difference, what you'll see, is because all hospital systems there's plenty of hospitals, there's 7 in this radius right now, but not all of them are safety nets. So each state might have one safety net hospital, and one region might have a safety net hospital. Not every area in the region has a safety net hospital. So you have a smaller, I'm going to call it the N number, which is the number of participants that might be using Press-Ganey and being able to participate in that.
Given all these variables, have you run across any other kind of engagement, survey, et cetera, that might be more effective for us in assessing our employee responsiveness?
We have looked at the different engagement surveys previously. Press-Ganey, the reason we went with them is because we also they are the ones who do our HCAP. So it's a complete package as a suite. So they do our physician, they do our employee, and then they do our customers. So they're able to bring us all the elements together to actually give us some strategies on how to penetrate, whether it's in the customer service area or whether it's in how to engage employees or risk, So we use a suite of products with them. But we can go out and look, if you would like us to see if there's maybe more tailored to a smaller hospital system. But the data would only be relevant for that.
I mean, it just seems we're susceptible to other variables with different kinds of hospitals that are not similar to us necessarily.
Sure. But every hospital also competes for the same amount of resources. So, and hold on, engaging employees at the level of whether you like your job, you feel like your work is worthwhile, whether it's safe in the environment. Those are all same, I call them hygiene metrics that employees respond to. Are your benefits? Do you feel safe? Do you feel that we deliver a good care? Do you think leadership is appropriate? Are they engaged? So those are similar questions that every hospital is going to answer whether or not they're a safety net hospital or not. Does that make sense? So that's why I say the questions are going to be similar no matter what product you use. It's just a matter of how you want to cut
The
it.
answers be different depending on the kind of hospital. And I don't know that that would be the case. I'm just asking.
Yeah, no. There's always a potential that the answers might be different, but I believe that if, and I'll use Northcrest, right? They're a small hospital that's up the street. I think they were acquired by Ascension. But if they were a smaller hospital and they were responding, they have the same set of questions and criteria that we do. And so it's all about the work environment and what you're bringing to the work environment and those hygiene elements again. So I think I understand what you're asking me to try to cut that data to get more specific to the fact that we're a safety net. But because we're a safety net, we have a different group of people that actually want to work here. When we meet with them on their first day, we say, we chose you, you chose us. And most of the time we ask them and go around the room, they say, why did you come here instead of you could work anywhere within the city? You have the credentials. 85% of our employees are licensed. And they say, because I'm mission-minded, I want to give back to the community. So we're drawing the employees that meet our mission. And then we engage them every year by asking them certain questions about their environment. So I'm letting you know that it's more specific than you think it is.
So I'm not trying to beat the dead horse, and I'll end it here, but what you just said, does that mean that we are unique in the sense that those employees would answer differently at a different kind of hospital, depending on where they're working? Therefore, I wonder how valid it is to compare us with a broad range of hospitals that have different purpose and different working circumstances.
Okay, well, I'll use the same thing as we do with our quality metrics. So we're a safety net hospital, but we have the same quality metrics that we have to report to the state, whether it's CMS or any other governing agency. We have the same metrics that we have to report publicly, whether we're a safety net hospital or whether it's Vanderbilt or it's Ascension. So I use that criteria to be able to say that this is the industry standard. And so as the industry standard, we're responsible for responding. And the metrics are the same no matter if you're a safety net hospital or not. The criteria is the same. You have the same set of criteria when you respond. Does that make sense? Technically, okay. Thank you.
Okay, so the 2025, going back to the employee engagement survey results as preset, I guess I would say, by NGH with the assistance of Press Ganey show to be between 3.98 to 4.11. I hope at some point we get to one of the examples that I'd shown you from, the airport authority, which says, hey, look, this clearly defines how you meet those thresholds of your bonus, 90%, 100, 110, or however we would set it. And I think this specifically would dictate those different types of levels. So yes, to your point, Craig, while this is acceptable, this is a stretch goal. And so I guess at this point, we probably need to just look at one of these preset goals as my recommendation and say, are we going to just use the one in the middle and say 4.03, or do we want to use a stretch goal at 4.11 or back to 3.98 because we have a couple months to go? So I think that's trying to go with the same theme of consistency for the short time period. How do you feel about that, committee members?
I think a stretch goal is exactly that, a stretch goal. And that means you go for what that ultimate number is, not just the average and not just an interim goal between average and stretch. I think you go for the stretch goal. Otherwise, you're not aspiring to be great. And I think we should always be aspiring to be great in every category that not only are we measured, but in everything that we do every single day.
I agree with that. And I think for purposes of this specific form and what we're engaged in here, we're talking about what is the amount of a bonus that's due to the CEO based on performance. So I think I have a good understanding now that when the measurement criteria is employee engagement survey results, if we find that we have reached the stretch goal, then a much higher bonus percentage is appropriate because we have done really well. If we underperform, then CEO still gets paid, but in this process, it's not right. The bonus is either going to be much lower or non-existent because it's a bonus based on performance. So anyway, I now understand how this tool is helpful for us to come up with that determination.
And I think that really helps us, David, to your point, as we go into the next fiscal year, so that at the beginning of the year, the CEO says, look, if I'm going to get the maximum bonus on this, then I know I've got to get everybody on board for this ultimate number, rather than, well, you know, we did okay last year, we'll do okay again next year. I think that's where the aspirational number comes in. Mm-hmm. Thank you.
Okay, any further comments on customer service? So Janet will make the change to the goal of 4.11. If not, we'll move to the last category, which is board relations and communication. So I know, Mr. Lusser, you've had for very specific goals and comments that you've had around this category, so I'd like to let you lead this part of it.
I'd just like us to be more specific. I have seen, rather than getting into a review of what I've experienced in this last fiscal year and moving into this year. In fact, I have seen significant improvement, but again, it is because I have asked for it. And I think that as we move forward, certainly for 26 fiscal year, we have to be specific, more specific than we have been in the past, so that the CEO understands exactly what is expected and what would be a superior return at the end of the year for the CEO.
Anything?
May I suggest to expand this because it's so inward looking. Like the CEO bonus is determined on working with board members, keeping board members informed, providing information to the board. This seems like, you know, I don't want the CEO to think my job is to like always be focused on the board. I would like the performance structure to encourage the CEO to apply that sort of communication and developing relationships with other constituencies, many constituencies, including the board. And so my comment on this is that I think these criteria are good, board relations and communications, but I would either put the word community or partners or somehow have a part of this performance evaluation where we ask the CEO, how have you done this year in communicating, keeping informed, and maintaining relationships with your board, with our partners, and with the community? I'm not sure that's reflected in any of these categories, but to me, to be the leader of the Safety Net Hospital and the role that it's played in the community is really important for the CEO to think about performance outside of this boardroom.
I certainly don't disagree with that at all. I think that's a very, very important point. The only point that I was making in my emphasis with the board was that, and this is just my perspective in my now coming up on 2 years, is that the board, previous boards have not expected more from the CEO in terms of communication. And it is my belief, as this board has evolved over the last 2 years, that there has been a higher expectation of communication, direct communication from the CEO. So I agree with you about broadening that to reflect that activity throughout the community, to all of our constituents, to all of our important opinion leaders, et cetera. But the only reason I was concentrating on that was because I think the demand is greater now than it has been. The expectation is greater than it was when I first joined the board.
Yeah, I agree it's important and would just like to add to it, but not to diminish at all the importance of the board, of the CEOs working well with the board.
Agreed.
Okay, so we'll add in language regarding a community or partners, stakeholders, maybe to the board relations communication area. Any other ideas or recommendations for that key result area? Okay, if not, the goal will be we will work with Ms. Lesser to get an updated version of this 2025 evaluation form and get that out to the committee. We'll do the wordsmithing, follow up with any other questions that we have after reviewing, and be ready at the next meeting to kind of finalize that piece, if that works for you guys on timeline. Okay.
What is the timeline for that, for presenting this to the board, would you say?
Yeah, so that's my next piece, so that being that we have a board meeting forthcoming, and I would like to turn that around as quickly as possible. In a perfect world, since I feel like we've vetted the majority of it here, I would like to go ahead, have that updated, get that to us, let us wordsmith it, and then our next meeting is the 12th of February. I think, I can't remember. Okay, yeah, we've got another 2 weeks. Yeah, I would like to go ahead and get that out before our next board, not this upcoming board meeting, but the next board meeting. Correct. So the goal would be to finalize it at our next committee, make that recommendation to the full board, have the full board approve those changes, and then that way we could give it to Dr. Webb for his comments. That's correct. The 4% recommendation will go this time. Okay. Last item on the agenda is the contract discussions and review. As stated, that contract expires June 30th, 2025. Backing into that number, I've actually read this document and had a couple questions on it, received some feedback and information, but that document specifically states, and let me go for the record, the agreement will commence as of the commencement date and subject to the earlier termination provisions by Section 5 below shall end on June 30th, 2025, parentheses, the term. By no later than 90 days prior to the expiration of the term, the parties will decide whether to continue employment relationship and either extend the agreement subject to any mutually agreed upon amendments hereto, or enter into a new agreement governing the terms of their employment relationship following the expiration of the term. So if I back into those dates, March 30th would be 90 days approximately before, and we would need to provide any guidance if we were going to consider other alternatives. So if I back into that date, I think it makes sense to, if we decide, whatever we decide, probably needs to be finally approved by our full board meeting in March. And I would assume that we would need to have that to our recommendation as a committee be potentially passed from our committee to full board, or any findings and discussed before that. So, so that would be in the next few weeks. So I think it's important for us to read the contract and have a good understanding of the language and terminology used here. So,
So for scheduling purposes, our next meeting is February 12th, and on our agenda is to finalize the set of criteria for the 2025 fiscal year review. That's one agenda item. We also need, our committee, I assume, is going to make a recommendation to the full board at the March meeting about whether the parties are going to continue their employment relationship in the words of the agreement, and if so, how that's going to move forward. That is it correct that this committee is going to make a recommendation to the board on that issue?
Derek, you need to, look like you want to speak.
I have a couple of points to make.
Please, sir, go ahead.
The assignment of what this body is empowered or not empowered to do may be in question. I got an email from hospital staff regarding previous meetings and what powers were or weren't granted to this body, this committee. So that's still under review. Also, just as a practical matter, based on this 90-day timeline you alluded to, if you wait, whatever body may be appointed to review the CEO's contract, if that committee waits until your March meeting to bring that recommendation to the board, and if you didn't have a quorum at that board meeting, you will not be able to then have a special called meeting before the expiration of the 90-day period. So whatever your decisions may be, somebody needs to likely bring a recommendation to the board at its February meeting, or else you're potentially squeezed. I think that fourth Thursday in March is not within 7 days of that 90-day window, and you'd have to have, under state case law, 7 days advance notice of a special called meeting. So I'm cautioning you all that you may need some flexibility to consider, because I was the one that advised that the board has to make a decision and prepare notice for Dr. Webb at that 90th day. You have to have done both. So obviously a decision has to come before the notice goes. So, and I'm sorry, whatever the fourth Thursday in March is, does anyone have that available?
Too late.
Yeah, you would, if you failed to meet quorum, you're not going to be able to make a decision.
That'd just be cutting it too close anyway.
So I'm just suggesting that expediency, not to mean that you don't need to have an adequate assessment, but expediency, you're getting into the limits between now and you got a January meeting of the board, you got a February meeting of the board, and then you could do a special called meeting in March before the regular meeting, but it is going to be cutting it close to wait until the regular meeting date in March.
Board recognizes Dr. Martin.
Good point, Derek. I would ask Janet, in my memory of almost 4 years, I don't think we ever failed to meet a quorum in March. We failed in the summer. Janet, have we? Do you think we failed to have a quorum in a March meeting? Because I think that if you're thinking spring break, those are generally over by the last week in March in our community.
If I could make a suggestion, I think that we ought to plan.
Hold on just a second. Let me recognize, as the board recognizes, as the committee recognizes Dr. Miller as a board member here.
I think we ought to plan on having a special meeting in early March. If assuming that we haven't been able to do what we need to do in the February meeting.
The special call meetings would be at the discretion of the interim chair, or if you've elected a new chair by that time. But again, that's leaving it to the discretion of the chair or interim chair to call a special call meeting. Just making you all aware of what rules would apply.
I think that, finished, Dr. Martin? Okay. I appreciate those updates. I think it's very important that we are aware of such, make sure that we are providing adequate notice if that's the direction the board decides to move with. And obviously the quorum piece is really important in making this move and motion one way or the other.
Well, so let's get a little bit more granular on that. Then let's back it up to this committee and what its path would be to get to that point, and what what our role is and what the demand is of this committee prior to a board meeting.
And I understand, Derek, what you're saying about the first comment with regard to defining what the committee is set to do. And I think that is going to be addressed at our upcoming board meeting to define that based on the bylaws. So it shouldn't be a problem going forward. But let's just be in hypotheticals at this juncture, legally speaking. If this committee were tasked with this specific piece, what would be your recommended timeline to make sure that we provided adequate space for not having a quorum, formally noticing, et cetera, and obviously creating space for any legal pieces that need to be crafted, et cetera?
Based on the information I have, following today's meeting, you'll have a February 12th meeting, by which time your duties should be well determined as it relates to the CEO contract review. You also have one on February 21st. So during those two meetings, if you plan to make a recommendation to the full board at its February meeting, you would need to conduct that business and have it concluded during those two meetings in February. If you weren't ready or prepared to bring a recommendation or weren't tasked with it or weren't ready to, that leaves you a March 17th committee meeting to bring your if you've reached a consensus on bringing a recommendation to the board for their regular March meeting that I believe you said a moment ago was on March 27th. That's your options as I see it, timeline as it currently exists.
Did you say we had a meeting of this committee scheduled on February 21st? So that would not give 7 days notice.
That was exactly what I was about to say.
Because it's
yeah.
6 days until the
For the February meeting.
until
but
the
not-
February board meeting. So we may need to, if we got a target of the February board meeting, that we may need to change the committee meeting date.
Correct. Okay.
So I'm in my phrasing, as you're currently scheduled, you got February 12th
Yes.
to
Or
reach.
we would have to move our February 21st meeting
Yeah.
up. Correct.
Move it or set another meeting beforehand.
Yeah, let's go ahead and fix that. The current date we had was the 21st.
The 21st. If you move it up, you may not have 7 days between the two meetings.
I'm fine with the 19th.
Could I ask, you are in the process, someone has raised a question of what this committee can do in terms of making a recommendation.
That's correct,
And-
based on what's in the public record of the prior minutes.
In other words, the question of whether this committee was tasked not only with CEO evaluation and contract consideration.
But let me make sure I understand, because this is my understanding, it is the interim chair's discretion to appoint those duties to this committee if he deems. Is that accurate?
That's correct.
Okay. So,
But it needs to be done in a public meeting.
yes. And I think that's going to be addressed at the upcoming board meeting. Yeah.
This is a public meeting of a committee, not of the full board. So that wouldn't constitute a meeting of the board.
So I will say that the previous chair, maintains that assignment was made to this committee. Apparently not in the minutes, but
So Dr. Martin, I actually pulled a transcript of the meeting. It was not during the meeting. He did say that to me afterwards, but it wasn't during the meeting.
That's quickly amended at the next meeting. So, I mean, I think we're kind of talking in circles. We'll get that nailed down.
I would just comment on this on process. I'm agnostic as to whether it's this committee or some other committee that the interim chair would designate to provide a recommendation to the board about the parties continuing this agreement. I do think it is important to do that in a smaller group committee that studies that in particular, and also talks with Dr. Webb about that in particular, in a way that is difficult to do in a full board meeting. I think as a matter of structure, it is important. The contract says that the parties are going to decide whether to continue the employment agreement. And honoring both the spirit and the letter of the contract, parties means Dr. Webb and it means the hospital authority. And so my suggestion, whether it is in this committee or another separate committee that the board and the chair may designate at the next board meeting, that this process include dialogue with Dr. Webb so that the parties have a discussion as the contract contemplates about the employment agreement going forward. And I would welcome to be part of that committee. I would welcome being assigned that responsibility by the chair. But if it's the desire of the chair and the board to have another committee do that, it's fine. I do think that it's important that a group do that and that group discuss with Dr. Webb leading up to this decision what the parties intend to do about his employment.
I appreciate your comments, David, and agree with you. I do think that for purposes of the deepest dive in terms of knowledge of his accomplishments, would be a natural fit for our committee that's already established. I think the expediency in which these things needs to be accomplished is another reason to probably stay with this committee. But again, it's at the discretion of our board chair. And same thing, I would welcome the opportunity if this duty is bestowed upon us. So.
Yeah, thank you. And I agree with that, having been part of these meetings and the work that we're undertaking, it is a natural fit. I'm surprised that it wasn't part of the original charge. And I agree with you that I welcome the responsibility if that is, because it fits with what we have been doing, if that is the desire of the chair. We want to make that clear.
We will make that clear at the next week's board meeting. I would ask the chair of this committee whether any addition to the committee would be appropriate, considering attendance records.
That's noted, and I will work with you as board chair to maybe make this recommendation as committee chair and see if that we can get that added to this upcoming agenda.
I recommend you make your request or
To Janet.
to Janet.
Okay.
Janet
Then
communicate
through
with the chair.
Buzz. Yeah, that's fine.
And anytime that you've expressed that you're
Yeah.
going to provide details or information to the committee, it's going through Janet to the committee.
Yeah.
Correct.
And that also gets back to your comment about communicating this, or a group communicating to Dr. Webb. That, my understanding, counsel, is one person has to do that from the board because two or more of us can't be in the discussion together.
That is the recommendation in order to comply with the Open Meetings Act.
So ultimately, that would be either the board chair or the chair of this committee.
Or someone that may be designated by the committee chair or the board chair.
Got it. Thank you.
Just as a follow-up, as part of the meeting minutes, and I failed to mention this at the beginning, I apologize. So the action items from our last meeting minutes were to obtain the complete history of the CEO's compensation, including any bonuses paid and the rationale behind them, review any existing contract the hospital has with a search firm, and determine if it can be utilized for any potential CEO search. So in my hand, we just received this information. The search firm that was previously used was a group called AMN Leadership Solutions, or its subsidiary B.E. Smith. And so that is the firm prior when we went through the executive search that was used. I do have a copy of the CEO compensation, which Janet will be sending out to all committee members, and you will be able to review that. That will discuss both his gross compensation and anything from retirement services to allowances, et cetera, for a total net salary. So you'll receive those today. Oh, well, she's already sent them. Not surprising.
Madam Chair, did we confirm and agree on the date for the second committee meeting?
Did the 19th work for everyone of February?
Not at this time,
Not
not
at this time, okay.
not at the noon hour.
Okay.
Is there another time of day that might work for you?
Yes, I have a hearing from 1 to 2 that I'll be preparing for in the morning. So if we could meet in the afternoon, then I could move it to the 19th at 3 o'clock or later, if that works with other committee members.
Works for me.
Yes.
Great, thank you.
Craig's
Thank
good.
you for
Okay.
accommodating that. And Madam Chair, I don't know if we have other action items that require a quorum of the committee, but I do have another obligation that I'm going to need to leave in
Yeah.
just a couple of minutes.
That is fine. All right, so we will make sure that Dr. Fagans gets that update as well on the 19th at 3 o'clock, moved from the prior date of the 24th. All right, if there's nothing else from our committee, then again, thank you for your time. Thank you for all of you who are in attendance. Appreciate all of your diligence to all the materials sent, and I'll accept a motion to adjourn.
Move.
Second?
Thank you.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.